Good morning, everyone. Today, we'll be discussing two life-threatening cardiac arrhythmias, ventricular tachycardia (VT) and ventricular fibrillation (VF). Understanding the differences in management of these conditions is crucial in saving lives.
Exactly. Both VT and VF originate in the ventricles, but their pathophysiology, ECG characteristics, and treatment protocols differ significantly. Let's start with ventricular tachycardia.
Ventricular tachycardia is a rhythm originating from the ventricles, characterized by a heart rate typically above 100 beats per minute. This happens due to abnormal electrical circuits within the ventricles.
On the ECG, VT presents as wide QRS complexes, often regular. It can be monomorphic, where all QRS complexes look the same, or polymorphic, where they vary in shape.
VT can be sustained, which lasts more than 30 seconds, or non-sustained, which lasts for few seconds. Symptoms may range from palpitations and dizziness to hemodynamic collapse, depending on the rate and duration.
Management of VT depends on the patient's stability. For a stable patient, antiarrhythmic drugs like amiodarone or lidocaine are used. In unstable VT, immediate synchronized cardioversion is performed.
And remember, the underlying cause must always be identified and treated, whether it's myocardial infarction, electrolyte imbalances, or structural heart disease.
Now, let's move to ventricular fibrillation. VF is a chaotic, disorganized electrical activity in the ventricles. It results in the heart's inability to pump blood effectively, leading to sudden cardiac arrest.
On the ECG, VF appears as irregular, wavy, and erratic patterns with no discernible Kerr complexes, P waves, or T waves. It's a medical emergency.
Exactly. The patient in VF will be pulseless and unresponsive. Immediate CPR and defibrillation are the cornerstones of treatment.
Defibrillation aims to reset the heart, allowing the normal conduction system to regain control. Alongside, advanced cardiac life support ACLS measures such as epinephrine and amiodarone are implemented.
To summarize, both VT and VF are ventricular arrhythmias, but VT often has some organized electrical activity, while VF is completely disorganized.
VT may allow for some cardiac output if the patient is stable, whereas VF results in no cardiac output and requires immediate defibrillation.
The key to differentiation is the ECG and the patient's clinical status. And don't forget, early recognition and intervention are critical for both conditions.
That concludes our overview. Remember, in both cases, teamwork and rapid action can mean the difference between life and death.
Absolutely. Together, let's save lives.